You know that feeling, right? That fiery sensation crawling up your chest after a big meal? Most of us just call it heartburn, pop an antacid, and forget about it. But what if that simple discomfort is actually a warning sign for something more? Today, we're diving into GERD, a condition that is way more than just occasional indigestion.
So to really get a grip on what's going on, we're going to walk through 5 key areas. We'll kick things off with what GERD actually is, then we'll uncover what causes it, learn how to spot the symptoms, and, most importantly, we'll get into the powerful lifestyle changes and treatments that can help you take back control. All right, let's get right to it. What in the world is GERD?
Yeah, that pretty much nails it. That burning feeling is the absolute classic sign of heartburn, a sensation I think most of us are unfortunately familiar with.
But here's the real million-dollar question. When does that feeling stop being a one-time thing from that extra slice of pizza and start becoming a sign of a real chronic issue?
And that's exactly where GERD enters the picture. The key word here is repeatedly. See, GERD isn't about having heartburn once in a blue moon. It's a persistent, chronic condition where stomach acid is constantly making an escape, flowing back up into the esophagus, that tube that connects your throat to your stomach.
So why does this even happen? Well, it all comes down to this tiny muscular valve at the very bottom of your esophagus. The absolute best way to picture it is to think of it like a smart one-way door.
Now, when it's working properly, this door, which is officially called the lower esophageal sphincter, or LES, is the perfect gatekeeper. When you swallow food, it swings open just long enough to let it pass through, and then it immediately snaps shut, creating the super tight seal to keep all those powerful stomach acids locked safely inside.
And right here, this is the core of the problem with GERD. A normal, healthy valve stays shut. But a GERD valve, it's faulty. It's either gotten weak or it just relaxes when it absolutely shouldn't. This simple mechanical failure is what lets that corrosive stomach acid creep back up, causing all that burning and irritation.
So that leads us to the next big question, right? If it's a faulty door, why does this carefully designed door start to fail in the first place? Let's dig into the common factors and triggers that can mess with it.
It turns out several things can put a ton of stress on this valve. For instance, carrying extra weight increases pressure on your abdomen, which literally pushes stomach contents upward against that valve. And smoking, that's a real double whammy. It directly weakens the valve's muscle, and it reduces your saliva, which is one of your body's best natural acid fighters. Even something as simple as eating huge meals can stretch the stomach and mess with the valve's seal.
But it's not just about those long-term factors. The little things we do every day play a huge role too. Certain foods, I'm looking at you, chocolate, fatty meals, and caffeine, are notorious for relaxing that valve. And then there are the habits, like lying down right after eating. You're basically giving acid a gravity-free highway straight up into your esophagus. It's really a combination of what you're doing and how you're doing it.
And the list doesn't stop there. Some common medications, like certain kinds of pain relievers, can add to the problem. And stress. Oh, stress. While it doesn't directly cause GERD, it can absolutely make your symptoms a whole lot worse by ramping up your stomach's acid production.
So when all of these factors come together, they can trigger a whole range of symptoms. And it is so important to listen to these because they're your body's main warning system.
So heartburn is obviously the headliner, but it is not the whole story, not by a long shot. Regurgitation, that awful sour taste of acid in the back of your throat, is also super common. But GERD can be sneaky. It can hide behind symptoms you might not expect, like a cough that just won't quit, a hoarse voice, or even a weird feeling like food is stuck in your throat. These are so often mistaken for other problems.
And this is why it's so important not to ignore those signs. Over time, that constant acid bath can lead to serious trouble. First, it causes inflammation, which is called esophagitis. If that keeps happening, your body can create scar tissue, which actually narrows the esophagus. And in the most severe long-term cases, it can lead to a condition called Barrett's esophagus, where the cells in your esophagus literally change, and that increases the risk of esophageal cancer.
Okay, I know that sounds really serious, and it is. But here is the good news, the really good news. This is a very manageable condition. There is so much you can do to take back the driver's seat, so let's get into the solutions.
This right here is your first line of defense, and honestly, it's incredibly powerful. Simple little changes like eating smaller meals more often, or avoiding your personal trigger foods, and just waiting a couple of hours before you lie down can make a world of difference. Even something as simple as propping up the head of your bed by a few inches uses good old gravity to help you out while you sleep.
But what if those lifestyle changes just aren't cutting it?
Well, that's when it's time to talk to a doctor and start exploring the path to medical relief. Doctors usually follow a pretty clear pathway for this. It always starts with those lifestyle and diet changes. If symptoms are still hanging around, they might suggest over-the-counter antacids for that quick, in-the-moment relief. For more persistent GERD, the next step is stronger medications that actually reduce how much acid you make. And surgery? That's typically a last resort, reserved for very severe cases.
And it's really helpful to understand how these meds work, because they're totally different. Antacids are like the firefighters. They rush in and put out the existing fire by neutralizing the acid that's already there. But medications like PPIs and H2 blockers, they work differently. They're more like fire prevention. They go to the source and reduce the amount of acid your stomach produces in the first place, which gives your esophagus a chance to heal and helps prevent future fires from ever starting. So, let's boil this all down. What are the most important things to remember? First, GERD is not just heartburn. It's a chronic mechanical issue with a faulty valve. But, and this is a big but, you have a ton of power here. Those lifestyle changes can be game changers. And probably the most critical takeaway of all, do not ignore persistent symptoms. Listen to your body.
Which really just leaves us with this final thought. The next time you feel that burn, just pause and ask yourself, is this just a minor annoyance, or is my body trying to send me a message that's actually worth listening to? Paying attention now could make all the difference for your health down the road.